Welcome everyone to another edition of the Mcbridge Consult Media Chat Room under the Mcbridge Consult firm. And my name remains Faith Afolabi, the host of the Mcbridge Consult Media Chat Room for Humans of Nigeria, job professionals and a non-profit. So last week we interviewed someone I've worked with for a while, and she's into community development, and she shared a brief of a story of how she started from the university and where she is right now working with an international organization. Today will not be different. We're going to be meeting someone I respect so much and I've worked with, and he will be sharing his journey of how he moved from practicing medicine into public health. But we'll be going on a very short break, and when we come back, you'll meet him. So welcome everyone, and we're excited if you're just joining us. This is the Mcbridge Consult Media Chat Room for Humans of Nigeria, job professionals and a non-profit. So we have our first public health guest, so let's meet you. So tell us your name and how you started on this journey.
Okay, good day everyone. My name is Dr. Oluwatosin Adeoye. I'm a public health physician. Medical doctor who specialized in public health. Presently, I work for the Society for Family Health in the Abuja office. That's where I'm presently working as a senior technical specialist of the research departments. Thank you.
All right, so how did you get that this far as a medical doctor?
Okay, so yes, so I'll give a brief background of what's my transitioning from the clinical practice to the development work. So when I was in the teaching, when I was as a medical student, I wanted to specialize in internal medicine, nephrology, part of internal medicine. But my reputation changed during my housemanship, and I felt that how could I, why not work in the preventive parts of medicine rather than the curative parts. So it was during the housemanship, because during housemanship you rotate through the different departments and hands-on experience practicing pediatrics, surgery, obstetrics and gynecology, and internal medicine. Just that I even did my work of my housemanship in that internal medicine department, in the nephrology department. So then I just thought about that preventive medicine could be better off. That's why do you want to get to curative? So that was what changed my orientation. So basically, I went into residency, postgraduate training, or residency in the teaching hospital in public health.
Yeah.
So of course, when you are doing your residency training, you have to do it in the concept of accredited hospitals. So I did mine in teaching hospital, LATEX teaching hospital precisely. That took me like 4 years thereabouts before I became a specialist, a consultant public health physician. So when I became a consultant public health physician, I worked in the teaching hospital too for a period of about 2 years thereabouts, the hospital consultant. However, during this period, during my residency training period, I had the opportunity of consulting for some development organizations, Family Health International, Achieving Health Nigeria Initiative, Family Sciences for Health. And I saw that I could, if I'm in that space, beyond staying in the hospital, I could have more impact in supporting facilities, going to the community, preventive medicine and the like. So after working in the hospital for years, I decided that, okay, I had enough in the clinical practice, that it's time that I can move on to development work. So that's when I moved on and joined development work since 2015 precisely, when I joined fully. That's what I've been doing up until now. Thank you.
Wow, that's been a journey. So you had mentioned at some point you decided to do preventive medicine instead of curative. Was it out of a sincere desire, or was it because the sector in the medical sector wasn't working for you, or you developed that passion? And then how did you move in? How did you get your first job in public health?
Okay, so to answer your question, I think It's the combination of the two, what you just talked about now. Then, like I mentioned, I was doing my housemanship, and housemanship is basically about curative parts, pediatric surgery, obs and gynae, and internal medicine. And I saw that what's obtained is not what I was saying in brand. So sometimes the patient comes in, you know what to do, but there's no facility to get it done. And once there are no equipment or whatever you want to get it done, they are limited. So a patient comes in, you probably know that this is what I'm supposed to do, but because you don't have the right equipment to intervene, you may not be able to give the patient the best, or probably you may even lose the patient. So for me, personally, I felt curative medicine, especially because of nephrology. Nephrology is about people with kidney problems and the likes. Probably the best, as at that time, kidney transplant is not really a common thing in Nigeria because of what it feels. So you get to go for dialysis. It's even better. Dialysis is cheaper now. Then to dialysis was pretty expensive. So some people, they couldn't do dialysis for them. They couldn't afford it. And you see people just dying. You can't tell about it. So it was a major thing for me. I saw it as, if I get into this field and I just end up being frustrated, okay, this is what you ought to do, but you can't do anything about it. So I started thinking about it again, okay, so what can you specialize in that you feel may help people? And that's when community medicine wasn't a thing that as a medical student I really liked. So it was something that how could you now impact in preventive medicine, because community medicine, some people call it preventive and social medicine. Okay, why not go into preventive medicine and see how you can really help and you still get fulfilled? So that was what really made me to go into that line.
Okay. Wow. Okay, so we'll be going on a very short break, and when we come back, we'll take a few questions, and that will be it for today's episode. Welcome back. If you're just joining, this is Mcbridge Consult Media Chat Room with me, Faith Afolabi, the host, and we've been speaking with Dr. Adeoye and he's a doctor and a public health practitioner. So he's been sharing his experience on how he moved from the medical aspect, the curative part, into the preventive part. And that started as a result of his passion. So it's possible to move from one sector to the other in the non-for-profit. For those of us doctors that want to transit from the hospital setting into the community medicine, it is possible. And Oluwatosin Adeoye has been sharing experience. So we'll continue. So is it possible for someone to still be in the hospital and practice community health, or you just have to quit and do one? Can you combine both? For those people that still want to keep their medical side.
Yes. So I won't say you can combine both. That you're working in both simultaneously, but it's very, very possible. So like I mentioned, when I became a specialist, I worked in the teaching hospital for a period of 2 years thereabouts. And then one of the things that, as a public health physician, you get involved in my hospital then, that's Latin Teaching Hospital then, where the department was in charge of the staff clinic. We had primary health centers that we do support. When I say support, we're able to pick cases and refer to the teaching hospital for special cases. Then the medical students too, because again, community medicine, public health is part of what they have in their curriculum. So we teach medical students. We have what we call bedside teaching, what we call teaching and preventive medicine. And again, we work because again, preventive medicine has to, from the primary healthcare level, we work in conjunction with the local government, state government. We have the state government Department of Epidemiology. When there is an outbreak in the state or at the local government level, the department does support. I remember then it was when I was in the hospital at the issue of Ebola came in. So it was our department that championed the issue of prevention. Yeah, they're about prevention, control, and the like. So you can work in the teaching hospital. Then again, the other side of it, if you're a specialist, I am, and you got a job in the confines of the university, you can teach the medical students, you can teach the nursing students, you can teach the laboratory students, the public health part of medical practice. And while you are doing that, while I was doing that, and while I was doing my residency, I was doing consultancy for, like I mentioned earlier, for some of these development organizations. The only part is that you can't combine two jobs. so to say, because it's your time. Even when you do this consultancy, there are agreements that there are forms that are being given from your teaching hospital that they sign that they release you to go and provide us consultancy. Usually 2 weeks, 1 week thereabouts. So you could do that. And it felt that okay, I should leave the teaching hospital entirely and move to the development work fully. So that's why I said you may not be able to combine the two simultaneously. And as it is now, I'm interested in some of the things because again, I'm interested in research and everything. So I'm still in touch with my colleagues in the teaching hospital in the university system. For example, if I have a registration by the teaching hospitals that needs people that can come, a lecturer that can come in on a temporary basis to lecture the students, it's something I can provide. Again, this will be like, to not be the other way around, like I'm providing temporary consultancy for the university. Then, so if tomorrow I want to go back to the teaching hospital fully, again, I can always just go back there fully. So it's something that you could easily move around both, and while you are in one, you can always still provide some level of support for the other sector. How does that answer your question?
Yes, definitely you did. So has there been any moment in your life where it's low and you just said, okay, you know what, I'm not going to pursue this community aspect, I'm just going to go back and stay in the hospital? If there are times like that, how were you able to handle it? But so far I can see you've been able to manage 2 sides.
Yes. So for me, I've never had a situation where I thought that, oh, I got tired of this and I want to go back to the hospital. And again, like I said, I've been in one thing I missed about the one thing I would have missed, let me use that word, not that I missed, that I would have missed about the hospital part. Again, for the hospital, well, based on my departments, we had a lot of researches that we do carry out and the likes. So it was one of the things I initially, when I joined the development work, that I found out that was not to me, because the hospital, the hospital is more like, it's not just about providing clinical services. The hospital is research, so to say, because the hospital is a tertiary institution where you have to think about research too. So there are a lot of research going on. So when I got to development work, that was one thing I found was not so common. But later I found out that it's a function of people that want to try things. So I remember then I had supervisors that are interested in research too. And it's something that now, even in development work, you have a lot of people doing researches. And so I have colleagues in the development world. Even my present, I just told you my present units in Science of Family Health. One of the things we do is data, driving research, and the likes. Beyond that, I'm very much in touch with my colleagues in the teaching hospital when there are things to think about. There are innovations to research about and the likes. We always brainstorm together about it. So that has not made me to really miss that part of the hospital setting. The only part I may talk about really that I say I miss a bit is now managing patients specifically. Managing patients
and see them recover.
Do your palpation and the likes. That's the part that I may say I miss a bit. But of course,
you want to go back there in the future?
Well, I don't see myself going to the hospital setting per se where I'll be managing patients, because really, as I said, it's something I decided on. As a public health physician too, you are not really expected to be managing patients. It's a preventive thing. You're expected to be looking out for, what's the cause of this epidemiology, and how can we prevent this from happening?
Okay, so did you do any form of training aside doing a course in public health to equip you to do your job well?
So, like I mentioned earlier on, I specialized in public health, and when I started doing that, it wasn't about development work. It was just about, okay, this is an area where you want to specialize in. Okay. So, in fairness, maybe that's an edge for me, because when you're doing residency now, beyond health, so when you are doing residency, you are training as a because you are training to become a specialist. You go through all sorts. It's the rigorous, what I call all over globally. So during residency training, you do a lot of presentations. You have to think outside the box. You have to think through before you go for exams, before you can pass the exams and the likes. You have the clinical part, you have the research part. You do research. In fact, generally, has been tends to be like equivalent to work like a PhD program. So it then prepares me for it. But that does not mean that everybody has to go through that residency route. So one of the things I tell young colleagues and doctors that wants to get into development work is as much as possible get your master's in public health. So you can finish medical school fresh, you have to go into residency, then you can get your master's in public health. Master's in public health is something that will help you too, because in master's in public health, you have the practical class and all the things that could prepare you. And another thing about I observed, that's one edge that the development work has, is the opportunity to volunteer. And interestingly, it's not like, let me say, it's a volunteer job. You may not be paid, but it can't. So you're preparing your CV and you put your volunteer experience in it. Interestingly, why I even got into it, apart from the consulting job that I did what in one of the organizations international. I did what they call a temporary hire. The temporary hire sounds like it's just close to volunteering. I was being paid for a copy not. But then I needed to learn the ropes. I needed to learn.
Yes.
Of volunteering. It may not be your full time, but if you get the opportunity to do volunteering, that way you experience. There's nothing as good as hands-on experience.
Yeah.
And when you go for job interviews, when you put all this in your CVs, it's something that people that will look out for, where you can be called. When you go for job interviews and they're asking practical, nobody wants to really talk about what is the book, say what kind of read that help. So your volunteering experience would help you. So in summary, to answer your question, as a medical doctor, if you get your master's in public health, that would be very good. If you get volunteering opportunities, that's awesome. That's it. That will definitely help you to prepare. And so you don't have to really specialize in public health, go through that route of residency. It's not really a must. If you want to go that route, fine. It gives you that edge. But if you don't want to go through that route, you can go through your master's in public health, go through your volunteering, and then of course there are a lot of online courses that you could go. WHO have free online courses that you could help to develop yourself to. And again, something I tell people again is that you should have somebody to talk to. Some people call it mentor. You could call them mentors of your life. It could be your colleague, or talk to people. My path all along, up until now, even when I'm switching jobs, I have people I talk to, senior colleagues, professionals. So when I wanted to move from the clinicals to the development world, I have about 4 colleagues that have moved ahead. So it wasn't a decision. It took like a year talking to them, looking at the option and the like. That gave me the opportunity of doing the temporary hire in an organization to make me learn more and to take a decision. So it's always good to talk to people again. Find things you don't know what you can gain, what you can add to yourself. So these are things that could prepare you for that journey.
Wow. Thank you so much, Tosin. It's been such a wonderful time speaking with you and hearing from you directly. So other people out there that want to move from the clinical side into the public health, the non-for-profit, are able to hear your story and they're able to do it and to know it's possible. So I want to say thank you, because this is where we draw the curtain close for today. Thank you for accepting our invite. And for those of us watching out there, this is the Mcbridge Consult Media Chat Room, and stay in touch with us because we'll have more episodes coming your way. And don't forget to follow us on our social media handle.